Hi, in today's video, I have another success story to share. So I'm going to talk to you about how we took a 55 to 60 prism diopter esotropia, which is a really large eye turn in, and we've gotten her reduced by half. I'm also going to be telling you about her lens prescription. But before I do that, let's talk to you about how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, that's okay. Go to our website at visionforlifeworks.com. If you're ready to take the next step, then the obvious answer is click on the schedule a consultation button and go ahead and proceed with a consultation. If you're not ready for that step though, you can read along the information in our website, and you can also take a questionnaire. That will just get you into our system so that you'll be receiving weekly emails from us, and you'll be able to learn more about our practice. Now, let's talk about this success story. This is really awesome. She started with us in January of this year. I saw her today in the office for a follow-up visit, and she's doing remarkably well. So we've been able to take her from a 55 to 60 prism diopter esotropia, which is a very large eye turn, almost to the point where the eye is really pretty well buried in towards the nose. And so that would mean that if this eye is the focusing eye, it would be aligned, this one would be crossed way in. If we switched and this eye became the eye that was aligned, this one would cross way in. So we've taken her from that 55 to 60 prism diopter esotropia down to about 28 to 30. So there was a little bit of a range there depending on what area of gaze we tested her in. But we've done this through the use of Syntonics in phase 1. And now she's in phase 2, a couple of months into phase 2, and she is, let's see, how many weeks into phase 2? About 15 or so weeks into phase 2, I think, approximately. And so she's doing Syntonics plus active vision therapy, training the brain how to align the eyes. Now, we haven't just had an eye turn shift back in the right direction for her eye to come out and be aligned more straight, but we've also had a big change in her lens prescription. She went from a minus 775 down to today. She was seeing very well with a minus 6 in both eyes. So from a 775 down to a minus 6. I even gave her a lens prescription because our next step will be getting her into a minus 550. That's a lot of power being decreased, and that's totally awesome. It's what we expect to see for our patients. Most of our patients are going to reduce in their myopia about 30 to 50%. And this is going to just further help her learn how to control the alignment of her eyes. One of the things that was really interesting was she said when she first got her 775 from another doctor, it just seemed overly strong and she couldn't adapt to it very well, and it caused her to have some headaches and some problems. And now she's super comfortable wearing a lens that is a minus 650, which is down from 5 notches from the 775. But today, the minus 6, she was comfortable with that. So I gave her a new lens prescription to start that one, and also again gave her a minus 550. We're going to have to work her into that 550 where she's going to be more comfortable and confident with it, but she felt perfectly fine with the minus 6 today, and our goal is that in another few months we will see her being perfectly fine and comfortable with the minus 550. Now, reducing that minus 775 down to the minus 6 has been an integral part of helping us to reduce her esotropia. So in addition to using the Syntonics, which is directly and specifically targeting the muscles of the eyes to pull the eyes into an outward position, then reducing the lens prescription is also like taking some of the stress and some of the strain off of the binocular system, allowing her effectively to slightly get more binocular or to be able to even achieve it. So we still have a lot of work to do with this patient, but we've come a really good distance with some truly significant progress that I'm really, really happy about. Her mom's very happy. She's super happy. In fact, one of the really cool things is that this young patient, she's 12 by the way, but this young patient was wearing a frosted lens. So she would take this frosted tapey stuff and she put it all over one eye. completely blocking out the image from one eye because it was so hard for her to try to get anything. She just saw double. She just couldn't tolerate it. And a couple of weeks ago, she just decided to take that frosted covering off of the glasses because she's so close and she's more closely aligned and it's not bothersome for her at this point. So that is very exciting. And I know that just around the kind of corner is that we will be getting her to have better alignment and even starting to notice some stereopsis. Now, when does that happen? If she's still a 30, 28 to 30 prism diopter esotropia, when can you expect to see some level of binocularity and stereopsis to be achieved? Well, it usually starts somewhere around 15 prism diopters. So if we came from 60, we're down to roughly 30, and we needed to get to 15, that'd be the point that we start to see some normal binocularity kicking in and some normal stereopsis. And then that is a driving force where the brain is like, wow, this is so amazing. I can't believe I'm seeing like this. That it almost pulls the binocular system the rest of the way. So from that point, if we've gotten from 60 down to roughly 15, then the brain is like, I'm ready. Let's rock and roll. Let's get it all the way down. And then from there, it's a lot easier to get them down to having no esotropia. But it is a lot of work to go from 60 down to where we're at right now and reduce it by half. So I hope you help us cheer her on, but she's doing an amazing job. And if you are interested in learning more about how we help our patients, just like we've helped her, then you can call us, certainly if you're local, at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com and schedule a consultation, or just look around and get comfortable with what you see and then decide later on to take your consultation time. Now, if you haven't done so already, please hit the like button, subscribe if you've not done that as well. And if you know someone who has esotropia, or, although I didn't talk about it, exotropia or hypertropia or something else visual, and you feel like this would be beneficial, please pass this on. Thank you.